One day I was going down the road in Chiswick, minding my business, and got into an accident, got taken to hospital, stayed in there for quite a lengthy period of time. 2-3 months of not paying the bills, the flat evaporated. I found myself coming out of hospital without a penny to my name and nothing to go towards, and that was sort of my journey into homelessness. I was in a job for 10 years, so that was from 2006 to 2017. That was my entire 20s. That was quite a few relationships that I left behind. So there was the psychological impact of that, coming out of the hospital to find out that they went through the procedures to let me go from the job, which I don't blame them. There are procedures to follow, and I didn't follow them, but I wasn't in the position to do so. And then suddenly nowhere to go. On the day that I left hospital, and I was given my medication in the bag, I made my way out the hospital. There wasn't much in terms of directions, or to be fair, I didn't tell my scenario to them. I suppose pride got in the way, and I didn't tell the full scenario, and off I went into the world. Firstly, I thought by telling the doctors, it probably wasn't going to change my scenario, one way or the other. Number two, I didn't know what the scenario was, It was still a bit up in the air. Three, it probably was denial, a little bit of pride in the same way to expose that to another person. Like any kind of scenario, no matter how crazy it seems, you adapt. And after a week, after a month, after 2 months, after 3 months, your old life starts to fade away. I had a car at the time, so initially I was sleeping in that car. I did that for about 3 weeks. Eventually the car got towed away because obviously I couldn't pay the parking. From then on, I had a little bit of money still left in my account, so I rid around on a bus. Went on a night bus, went to Heathrow, stayed there for a couple of days. Eventually ran out the money for the bus pass as well. And at that point, I literally walked around at night time. I didn't really bed down. I stayed on a park bench and stuff. I had asthma at the time, and I didn't suffer it from a child, but at the moment of having the accident, it brought it back. So there were daily asthma attacks happening. It could have been stress, but it was happening regularly, and my capacity started to drop. I'm a kind of person that if you give me a phone number or something, I can hold that information in my head. I suddenly couldn't do simple things of just remembering something someone told me an hour ago. With the asthma attacks and the injuries that I had, I suddenly found myself physically not be able to trust my body to do what it needed to do. Walking across the road became a difficult thing. Walking a mile or two, which I did for a laugh down the canal or in the countryside, suddenly became impossible. So you find yourself in a physically diminished state, and you do get a bit anxious in terms of getting the help that you need. You're a lot more frailer than you were before. And things like waiting extra periods of time in A&E and so forth could cost you severely, There were scenarios where people that were drinking and they got quite aggressive, and suddenly I had to become aggressive to stay alive. And I'm not that kind of person. I'm a quiet, read a book in the corner kind of person. Suddenly I found myself having to be a lot more assertive than I ever normally was. Your social circle are not going to exhibit the normal, regular behaviours of the people around you in the mainstream. So your behaviour slowly will start to match your surroundings, and there's going to be a bigger and bigger disconnect, the day by day, hour by hour, from the mainstream. And the longer that you're in that environment, the harder it is for you to come back. And that is one of the biggest problems people face in homelessness, where they'll literally get entrenched because they've adapted so well to survive in the environment they found themselves in, that to adapt back into normal society is going to be quite hard. In the end, I found what you call like a day centre. I didn't know what that terminology meant by accident. Went into that place, started interacting with people, they gave me a bit of food, and from there they told me where other services were. And then I slowly started building up a sort of map of where to go on different days. And started to help out at that day centre, like doing a bit of gardening for them, doing cooking and stuff. And they put forth an application to get me housed, and got put in a B&B for about 4 to 6 months, and for there got put into a flat. When I went to Ealing Hospital, when I was having another asthma attack, I couldn't get admitted due to the fact I didn't have ID, and managed to get myself into Chelsea and Westminster. And as I was getting the blood gas test done on my arm, a doctor just sat there and had a conversation with me, and probably kept me in the hospital a little bit longer than she needed to, check my medication, check my inhaler technique and all sorts, and actually got me to think about other things to do with my health. And that was the journey in terms of getting myself back onto my feet, in terms of getting my health under control. One of the biggest gaps that I saw was the difference between mental health and physical health. If a person has a mental health, it's hard for them to get physical health treatment, and vice versa. And I would love to see that those two teams be brought closer together. I'd probably say the setup of the urgent care centres sometimes prevent you accessing care as quickly as possible, where you've got a triage that you've got to wait for with the urgent care, and if they deem you fit, if they deem your situation serious enough, they move you onto the A&E to get seen. And as an asthmatic, by the time you've waited to see those guys and you suddenly go get the help that you actually do need, it might be a bit too much time that's passed between those 2 points. The hardest bit would be you'd go into hospital for a few days, they'd help you out as much as they could, and then they'd expect the GP to take the journey the rest of the way. I didn't have a GP to go back to. The area that I was in was quite far from the area that I suddenly now found myself into, and re-accessing it, I didn't know how I could do it. I thought I need utility bills, I need ID and so forth, all things that I didn't have at that time. You have no place to receive a letter. You know, your life is not stable enough that you can plan out that next Tuesday at 11 o'clock I'll be available, you know. So in terms of accessing it, it was, apart from walking into an A&E, that was my only version of access to the healthcare. And in the day centres where the homeless people go, that there's outreach services that come out there. So particular ones, you'd have like a doctor to come out every 2 weeks, a nurse that would come in, a dentist that would come in. Those are found massively helpful. By coming into that environment, they're a lot more understanding of their clientele than going into like a mainstream service when you're not in a state to go access those services. What I would like to say to anybody that was watching this would be that the NHS as a whole is a wonderful organisation, but sometimes the communication between the left arm and the right arm is not always the perfect. My ideal fix would be, just a small little change would be that if someone was in hospital, that the minute they exited hospital, that was an automatic ping on their GP side, so the GP was aware of why, how, and what the next steps were. And it would really bring those two worlds a lot closer together. Maybe get like the nurses to come around like a day or two before the discharge or on the day of the discharge and just have a 5-minute chat, or maybe put a couple of questions in a discharge form just to double check, you know, is there an address that the person can go back to? Can they really go to the follow-on appointments? It would be really great if GPs could come out into the community a bit more. Again, with the whole IT issue, it'd be really great if that there was a bit more communication between hospitals and GPs. I'd love it if the NHS spine held a bit more information, that it could actually follow you around. You know, I think it's some bit lagging in terms of nowadays that we can back up all our information to the cloud, and you know, having all kinds of devices where our medical records, which is probably the most important thing, should be really easily accessible by all healthcare professionals, and it should follow you around. It shouldn't be trust by trust, and there shouldn't be lines and silos to stop your data moving around. It should be moving with you. And particularly for homeless people, because they're so transient and the data's not so transient, that's where some of the roadblocks start to happen. I think listening to your customers, in a sense, in any kind of organization or business, is always helpful. That the clientele that you're going to serve should have some sort of input and sort of help you shape your service, and your service will be a lot more responsive and probably a lot more efficient in the end if you do that. Where if you do it in isolation away from where you're going to deploy it, no good plan is going to survive with contact with the enemy. So it would help if you brought the clientele on board. Just give me a different perspective, like I said. I found myself in a scenario that I thought it wouldn't happen to me in a million years. The healthcare is literally central to your life. Your body is the engine that drives you forward, and if that fails or is not functioning properly, it is going to impact every area of your life. And sometimes you need to start at the base of the pyramid before you build up. To anybody that's working with homeless people, what I'd like to say is that what you're doing is absolutely amazing, and that to keep up what you're doing, you know, the impact that you have on people's lives, you probably won't realise, but you have a massive impact on all of us.